Many people don't realize, though, that there are different types of incontinence. Can you explain the differences in simple terms, please?
Sure. Well, urinary incontinence is generally the uncontrolled leakage of urine. It might happen during the day or at night, and we try to classify the types of leakage depending on the cause. So, stress incontinence is leakage that occurs when you put your lower abdomen and pelvis under strain, such as during coughing, standing up, sneezing, laughing, or just exercising in general. Urge incontinence is leakage that occurs when your bladder feels this uncontrollable need to empty and you leak before actually finding a bathroom. There can also be situations where our bladders don't empty at all. And when our bladder is overfilled, the urine just spills out. And that's something we call overflow incontinence. And then there can be a combination of the different types of incontinence, which we'll call mixed incontinence.
You mentioned stress incontinence. Let's focus on that one first, which happens during things like sneezing, as you said, or exercise. What causes it?
Well, we all have support mechanisms that keep our bladder and bowels under control. So some of these supports include a collection of muscles that we collectively call the pelvic floor muscles. And these muscles act like a hammock that support and hold up the pelvic organs. We also have valves or sphincters located at the opening of the bladder and bowels that help to provide control. So stress incontinence happens when the strain coming down onto the bladder from something like a sneeze or a jump or a golf swing, when that strain overwhelms these support mechanisms, we leak urine.
On the flip side, you did mention urge incontinence and that is associated with sudden urgency. So what causes that?
If we think of our bladder as a muscular storage space and pump, and we know that it relies on a coordinated relationship between our brain and bladder to help us store urine and then drain urine, the bladder also needs a strong supportive pelvic floor to function properly. So for some people, their bladder does not want to store urine as strongly as others. Or sometimes our bladder does a great job of storing when we're young, but then betrays us as we age and no longer stores as well as it once did. If our bladders can't properly store urine, we get a strong, overwhelming signal from our brain to get to the bathroom. And if we can't suppress that feeling in time, we'll leak urine before even reaching the toilet. That's urge incontinence.